Hey everybody, updating on my progress. As most of you know, I was scheduled for surgery this past Friday. Today's date is, you know what? Hang on. Today is Sunday, March 22nd. I was supposed to have surgery on Friday, but my surgeon wasn't coming back into town until Sunday, and so my surgery got pushed to Tuesday. So I've been dealing with quite a few bad flare ups. Yesterday, I was at what I would consider ER level pains, um, but I had some rescue medication at home that I was able to take, and it was bad enough that I was a little worried that I might be taking too much of that. But something had to give because I was just crying. I was swollen and red all over the side. Um, just the awful stabbing in the eye and in the ear. So I asked my fellow TN support group members to submit some questions that they'd like me to answer during this video. So now that I've kind of updated on where I am, I'm in just a holding pattern until Tuesday. I will go in on Tuesday to have the wires um, replaced into my face. For those of you who don't know, I had a neurostimulator implant put in a trial on February 17th, the full implant on February 19th, and it was working wonderfully. Other than surgical recovery pain, my face pain was almost completely gone. I'd say 80-90% better, which is amazing. Um, I do have, you can see right here where my battery is. Um, that has healed up a lot better than I thought it was going to. Um, there were 9 staples there, and that may have been actually the hardest part for the healing process. And they don't have to do this part again. So what happened was kind of a freak occurrence. My surgeon said he's never quite seen anything like it. The wires came completely out of my face, all the way back, and recoiled down near the base of my skull where the connector pieces, where all of the wires connect into before they run down my neck into the battery. So that's where we are with me. Now I'm going to get to answering some questions from people. So my first question is going to be somebody wanted to know about the beginning of my neuralgia, what caused it. As far as I know, my trigeminal neuralgia was caused by a congenital defect of a vein or an artery compressing the trigeminal nerve somewhere close to my brainstem. Sorry, my arm was getting uncomfortable there. Um, I've had what I would consider to be more than likely trigeminal neuralgia attacks at least since I was a teenager. I used to tell my mom when I was putting on eye makeup that there was a certain spot on my left eye that if I touched it with the eyeshadow wand and it would get a burst of pain, that I just knew I couldn't go out that night, that a migraine was coming on and that I would be down for the count. Well, so it turns out that I was hitting the trigger point and causing trigeminal neuralgia flare-ups. But I was also having long periods of remission. Um, I also, in my 20s, probably self-medicated with alcohol a little bit to help with the pain. So, but I mean, it was my 20s. I just thought I was having fun with my friends. But I did have an awful lot of pain, and it wasn't until I was diagnosed that a few of my friends who knew me growing up said that they recalled me talking about how much pain my eye was in multiple times. So we at least know that the trigeminal neuralgia goes back to my teenage years. I was diagnosed with fibromyalgia as a child. I missed a lot of school. I was sick a lot. I had a lot of strange symptoms. But at the time, it was still considered a junk diagnosis that doctors just gave you whenever they couldn't figure out what was wrong with you. So nothing was ever really done about that. Now that I'm older and dealing with the trigeminal neuralgia, and I've been through some physical therapy and had physical therapists tell me that I probably have fibromyalgia, it's probably something that I need to look into as well. In October 2011, I got a really bad sinus infection that wouldn't go away. I went through at least 4 or 5 rounds of antibiotics, Bactroban, nasal washes. They mentioned that I might have MRSA in my sinuses. It was awful. I finally had a CT scan come back clear, and I was in my doctor's office crying and bawling with ice packs on my face. And I said to him, if my sinus infection is gone, why do I feel like I've been hit in the face by a baseball bat, and why isn't the pain going away? And my ENT said, I think you might have something called trigeminal neuralgia, and you should see a neurologist. And that was the beginning of my journey. I needed sinus surgery as well, so we decided to go ahead with sinus surgery in May of 2012, after we already knew I had trigeminal neuralgia. There was some hope on my part that something in my sinus was compressing my trigeminal nerve, and that being put under might reset my pain buttons, and that I might wake up feeling better. So I had sinus surgery, and I'm not sure I would recommend that, having trigeminal neuralgia and then having sinus surgery. I'm sorry, I have to rest my elbow. My arms are getting tired. So we're going from this angle. That was the start of my long list of surgeries. So sinus surgery, May 2012. July 2012, I had my first microvascular decompression of the trigeminal nerve. That was my first brain surgery, with the promise that, that was my best chance at having 9 to 10 years of no pain. I had about 3 months where I was pain-free after that surgery, and it was glorious, and I loved it. When I woke up, I had no TN pain whatsoever, but it did come back. And when I went back to see the surgeon, he said that he wanted to go back in, and they put a bigger piece of Teflon in, and he did something while he was in there called rubbing the nerve, which the thought behind it was that if he gently rubbed on the nerve, that he would cause it to kind of reset or scramble. Well, what happened was that I woke up in more pain than I had gone under in, and I had non-stop burning, atypical trigeminal neuralgia after that surgery. After that surgery, we decided to go for Gamma Knife. I had Gamma Knife, their first attempt, when they were screwing on the halo, or the frame that goes around your head. I ended up having a 14-minute long seizure. I woke up thinking everything was fine and jolly, but they said, no, you had a seizure and you're going to have to come back, and we'll have to sedate you to do the procedure. So I came back like a week or two later. They put me under, they did the Gamma knife, nothing. I didn't even have any numbness, no tingling, nothing. So my surgeon then said, look, we could keep shooting radiation into you. It's probably not going to work. What I'd like to do is go in and cut the nerve. He had had another case similar to mine, a girl who came in from North Carolina, West Virginia, somewhere over there. And she left and went home completely pain-free. So I thought, well, maybe this is the answer. So after that surgery, I was incrementally better. I was numb probably from about here down. They cut the sensory nerves for V3. So I was numb from about here down and right to the midline. And slowly that numbness went away. So now I'm currently only numb in this area and down the left side of my tongue, although I'm starting to get feeling back in the tip of my tongue. So after all of that, I was still in pain. I was fired from one pain management doctor. I had a slew of just bad luck things happen along the way. And I finally found some really excellent pain management doctors and started trying some nerve blocks that were diagnostic. So I had supraorbital, infraorbital, supratrochlear, stellate ganglion, and sphenopalatine up the nose. I've had all those blocks. Oh, and occipital nerve blocks. I've had all those blocks more than once, because they all worked the first time. The first time was amazing. I went home with a face that felt normal, and I thought, praise Jesus, this is a miracle. I finally found it. But they wore off quickly, and the doctor said, don't worry. Part of it is that we want to see if you might be a candidate for a peripheral nerve stimulator. So we started pursuing that. We found the best guy of the best in our area, Dr. Daniel Kim, and we went ahead with the trial implant. It was going fantastic. We did the full implant. Other than surgical pain, my face pain was pretty much gone. And so I was very happy with that. And then the wires moved. So here we are. That's my full history for those of you who don't know it. So we'll start with some of the questions here. The first one was about how I got TN, and the answer is that nobody really knows, but probably just congenital. That's the way that I was wired, and bad luck. I had my 3 MVDs done. I had the first 2 done with Dr. Zube, Jeffrey Zube, at Memorial Hermann in the Woodlands. He's an excellent, excellent surgeon. Nothing that has gone on with my pain was in any way his fault. In fact, I woke up so thankful to him after my first MVD because it was the first time I was pain-free in many, many months, and it lasted for a few months. But, you know, it's just, we've started to learn that if it can go wrong, it will go wrong with me. So, I would still recommend Dr. Zube for anybody up in the Woodlands. I actually find Memorial and Hermann in the Woodlands a more comfortable hospital to stay at than Memorial Hermann in the medical center, and I would highly recommend not going to St. Luke's hospital in the Woodlands. I have had 2 stays there now that were so bad that the second time I asked to be let go early. Luckily, they didn't make me leave AMA, but I did leave early. Don't suggest going to that St. Luke's. I don't know about any of the other St. Luke's, just that one in the Woodlands. So, my third MVD and Gamma Knife were done by Dr. Dong Kim at Memorial Hermann in the Texas Medical Center in Houston, Texas. I consider him to be the most compassionate doctor I've ever seen, which is pretty amazing, not only because he's a neurosurgeon and they're not exactly known for that, but also because he's the head of Mr. Neuroscience. He's the top guy. He's one of the best neurosurgeons in the country, and he will sit down next to you, rub your shoulder, acknowledge your pain, treat you like a human being, and you really, really know that he's there to do everything he possibly can to help you. Cannot speak highly enough of Dr. Dong Kim or Dr. Daniel Kim. Any patient would be lucky to have either one. I have a question about how was my pain after Gamma Knife? And did it take it away or make it worse? Did it help me at all? And if so, for how long? So with Gamma Knife, the main pain is that they inject anesthetic that feels like acid right under your skin to numb where they're going to screw the frame into your head. For me, that started off what was going wrong, and when I had my seizure. That burned so bad, and then they began to screw the screws in, and it was like, I mean, do they not know what WD-40 is? Because every time they'd screw it, it would, that cranking noise, and it was starting to totally freak me out. And then they kept touching my face, and I remember telling them, stop touching my face, like really for real, stop touching my face. And nurses saying, I'm sorry, we have to do this for that. And then I remember nothing. That's when I went into the seizure. My experience of the seizure is very hard to explain and pretty personal, but not unpleasant, surprisingly. I didn't know anything unpleasant was happening. I woke up and I had 2 Tasmanian devil band-aids on my forehead. I think I have a picture of that somewhere. I got pizza and I went home and I waited to come back and be sedated to do it again. When I was sedated to do it, no pain whatsoever. They were all a little surprised that I never felt any numbness or tingling or anything, and I think that's why they decided it wouldn't matter to do it a second time. It wasn't going to work on me. Let's see. I have some questions about the wires moving. I have heard on rare occasions of the wires shifting slightly. When they x-rayed my head, because I told them I couldn't feel it in my face at all, I've never heard a doctor or more people in the room say the word wow in my life when they were looking at my head. My surgeon's been doing these for a very long time, and he is excellent at it. And even he said he'd never seen anything quite like it. So what has happened to me is extremely rare. Having your wires shift at all is very rare. Like I said, if it's going to go wrong, it will go wrong with me. That's just the way it is. So when he tells me that it's something that he's never seen before, my reaction is, of course not. It's me. Knowing what you know now, what would you do if you could start over? knowing what I know now, what I would do if I could start over is um, I might have gone bypassed seeing Dr. Zube, as good as he is. His specialty is not trigeminal neuralgia, microvascular decompressions. His specialty is really more in spinal stuff, even though he is an excellent surgeon. My mother at the time was friends with the CEO of Memorial Hermann in the Woodlands, and she asked him if it was his daughter, who would he recommend? And he said if it was his daughter, Dr. Zube would be who operated on him, on his daughter. I would have maybe done more research in the beginning, not just gone by what everybody told me and said, okay, I was in such extreme pain that I was willing to just go along with anything anybody said. At this point, knowing what I know, I wish that I had known about the peripheral nerve stimulator. I wish that that could have been the first thing that I tried. I'm not sure insurance would have paid for it without me going through all the other stuff, which is dumb. It's much less invasive. And in the short experience I had it in, has worked better than any of the other procedures I've had. So, I can't go back and change the past, and I'm not really a person who dwells on, um, wishing I could have done things differently. I'm just looking forward to moving forward with something that I know can work for me and hopefully will work for me for a long time. Um, I wish I had found support groups earlier, honestly. Um, I felt so alone for a long time. And when I found out there were other people like me out there suffering, it really it really helped me get out of a funk and a hole and feeling like my whole life was gone forever. Don't get me wrong, I still have my moments, but I have a much more positive outlook on life now, that I have all of you guys. Let's see. Did you have Gamma Knife before your MVDs? Doctors told me since I had MVD first, I wasn't a candidate for Gamma Knife. I had my Gamma Knife after my second MVD. I will say, after seeing my surgeon more recently, they've told me in the last 18 months that they've learned a lot more about trigeminal neuralgia, Gamma Knife. Um, where I go is one of the, leading research hospitals in the country, and they have basically said that if it were now, that they probably would not have done Gamma Knife on me because I had already had two failed MVDs. There's so much scar tissue. It's more damage to the nerve. And it just doesn't seem to be the right option for patients in my situation. Now, your situation may be different. I don't know your medical records. Um, I believe in getting second opinions, but from what I'm hearing from my surgeons now, people with my situation with multiple failed MVDs, that Gamma Knife may not be the go-to cure-all that they thought it was going to be, and then it may actually be causing more problems down the line than they intended. Um, let's see. Considering the outcomes you had with your MVDs in comparison to the relief that the implant was giving you before the current technical problems of it, would you repeat the MVDs or try the implant first? 100% I would try the implant first. The MVDs took me much, much longer to recover from. They say it can take up to a year to really feel like yourself again after an MVD, and I had 3 of them in 18 months. So, yeah, it's taken me a really long time. I still don't feel like myself. But with the neurostimulator, even though the staples in my chest hurt pretty badly, the staples in my head weren't nearly as bad. I had 2 in one spot and I had 4 in the other. And I would say the what took the longest for me to recover from with that was just getting the anesthetic out of my system. I don't do well with anesthesia. It took me almost like 4 or 5 weeks to get over getting my wisdom teeth out, and Tuesday will be the 4th time